Hi, my name is Amy Chappell. I'm a physician assistant with the Surgical Oncology Department at Roswell Park. Today I'm going to be talking to you a little bit about what to expect while you're recovering in the hospital after having a minimally invasive esophagectomy. As you know, an esophagectomy is a surgical procedure in which part or most of the esophagus is removed. The remaining portion of the esophagus is then connected up to the stomach, which is pulled through the chest. This new connection is called the anastomosis. Depending on what your surgeon thinks is best for you, your anastomosis may be made up in the neck, which is called a cervical anastomosis, or it may be made in the chest, which is called an intrathoracic anastomosis. Regardless of which anastomosis you have, the recovery period will be about the same. After surgery, when you wake up from general anesthesia, you'll notice that you'll have a few new tubes and drains, all of which are important and will help us to monitor you during your recovery. Depending on which variation of the surgery you had done, you may have some or all of these drains, which are going to be described. The first drain is called a nasogastric tube, or an NG tube. This tube is inserted through your nose. It will pass through the anastomosis and sit in the stomach. The purpose of this tube is to drain any extra fluid which may accumulate in the stomach, and it's also used to decompress the stomach, which will help the anastomosis to heal. The end of this NG tube will be connected to a suction canister. You will also have a telemetry monitor, which looks like a small box, and leads are connected to your chest. This monitor will allow nurses and doctors to monitor your heart rate and rhythm, and they can see this from monitors which are located outside of your room. About 25% of patients that have had major chest surgery will have an irregular heartbeat, which is called atrial fibrillation. Should that occur, it can usually be corrected with medications. A JP drain will be placed for those patients who have undergone a cervical anastomosis. If you have this type of anastomosis, you will also notice an incision in your neck. The JP drain sits right at the anastomosis, and the purpose of this drain is to collect any fluid that may accumulate in the chest after the surgery. All patients undergoing a minimally invasive esophagectomy will also have a J tube placed. This is called a jejunostomy tube because it's sitting in the small bowel. This tube is used to give you extra nutrition while you're healing. You'll be going home with the J tube in place, and the length of time that this tube will stay will depend on how adequate your oral nutrition is. Depending which variation of the surgery that you have, you may also have 0, 1, or 2 chest tubes inserted in the OR. The purpose of this chest tube is to drain any extra fluid or air that accumulates in the chest after the surgery. All patients having minimally invasive esophagectomy will also have a Foley catheter placed to monitor your urine output and hydration status. These are called sequential compression devices, or SCDs for short. These will be placed around your calves, and periodically you'll feel them squeezing your legs, and that's basically to massage your calves and keep the blood flow going to prevent any blood clots from forming while you're recovering in bed. After surgery, you can expect to remain in the hospital for about 7 days. After you wake up from general anesthesia, you will be in the post-anesthesia care unit, also called the PACU. You will then move on to the intermediate care unit, or the IMCU. The day after surgery, you will be helped out of bed into a chair by a nurse, and you may even feel well enough to be able to walk the halls. You should also be doing your coughing and deep breathing exercises with the use of the incentive spirometer. After 24 hours, you will then be moved to the general surgery floor on 7 West. While you are in the IMCU, we will be closely monitoring your respiratory status, heart, and vital signs. Once you're stable enough and feeling well enough, we will be moving you to a general surgery floor, which is typically about 24 hours after your surgery. When you're on the general surgery floor, you are going to be meeting different people, all who will be playing a role in your recovery. One of the people you will meet is called a case manager, who's going to be guiding you through the discharge process and helping you to ensure that you feel comfortable at the time of discharge. If needed, you may also wish to see a social worker. you will be seeing a nutritionist who will be talking to you about the J-tube feeds and giving you dietary education in regards to a full liquid diet. You will also be seeing a physical therapist who will be helping you to get out of bed, walk the halls, and get your endurance and strength up in time for discharge. On post-op day 2, we will begin to use your J-tube for feeds. The nutrition is in the form of a liquid nutrition which will go into the bag. It will then go through a pump and into your J-tube. We will start at a slow rate and gradually increase the rate until your bowels wake up after surgery, which means you'll be passing gas from below. You're going to be going home with the J-tube. So throughout the course of the hospital stay, your nurse will be showing you how to care for the J-tube, including how to flush your J-tube. On post-op day 2, as long as you're up and moving around, we will also remove your Foley catheter. On post-op day 3, typically we can remove the NG tube. The exact timing of when the tube is going to be removed depends on how well that you are healing. On post-op day 4, you will either undergo a bedside swallow study or a gastrographin swallow study. The type of study which you have done depends on which anastomosis that you had performed. Somebody who had a cervical anastomosis will undergo the bedside swallow evaluation. And for that test, either myself or one of the doctors will have you drink some liquid, and we'll watch to make sure that the liquid is going down okay and that you don't have any trouble swallowing. And as long as there's no changes to the color in this JP drain or the fluid output, then we will put you on a liquid diet, and we will typically remove your JP drain. For those patients who have an intrathoracic anastomosis, you will undergo a gastrographin swallow evaluation. For that study, we'll have you drink some contrast material and you'll be sent down to X-ray. They'll take a couple of pictures, and as long as everything looks good, then we will put you on a clear liquid diet. It's very important that when you're started on a clear liquid diet, that you're sitting upright whenever you're going to drink. You should also be taking your time and drinking very slowly. On post-op day number 5 is typically when we could think about removing your chest tube. Again, the exact timing that these tubes are taken out will depend on how well you are healing. You can expect to have another chest x-ray after your chest tube is removed. Around day 5, we will also be advancing your diet to something called a full liquid diet. Some examples of full liquids are ice creams, cream of wheat, tomato soup, or strained mushroom soup. Typically, you can also expect to have your medications transitioned from being given through the IV to be given through the oral route. These pain medications are in liquid form, and they can either be taken by mouth or can be given through the J-tube. After we advance you to a full liquid diet, we will also be cycling your J-tube feeds, which means we'll be giving you feeds over a 12 to 16 hour period to make it easier transition for when you go home. Day 6 to 7 is typically the time when patients are ready for discharge. At the time of discharge, we hope that you're able to feel comfortable in caring for your J-tube. We will also make arrangements so that any supplies needed or any help needed at home will be in place before you go. Some important things to remember for discharge. When you're going to eat, please be sure that you're in an upright seated position, and this will reduce the chance for any aspiration, which can cause pneumonia. It's also very important to maintain a full liquid diet. If you have any questions at all regarding the discharge process or when you get home, if you need to contact anybody, you can also call our clinic phone number or call up to the surgical floor which you were discharged from. When you're discharged, you will be receiving a full set of discharge instructions. However, if you get home and feel that you have any additional questions, please do not hesitate to call. You can always call the clinic, or you can call the direct number to the floor which you were discharged from. We'll be happy to help you in any way we can. We're here for you.